Micafungin 100 mg intravenous solution is an antifungal medication that is used to treat different types of fungal infections and to prevent fungal infections in patients undergoing a stem cell transplant. This medication belongs to a class of drugs called Echinocandins, which work by stopping the growth of fungi. The daily dosage and optimal timing of this medication should be determined by a healthcare professional based on the individual's specific condition and medical history. Make sure to follow their instructions carefully for the best results. When using Micafungin 100 mg intravenous solution antifungals, Glucan synthesis inhibitors, Echinocandins, it is important to follow your doctor's instructions. It is usually given once a day over 1 hour, and the dosage and length of treatment depend on your medical condition and response to the treatment. For children, the dosage is based on their weight. If you are administering this medication at home, make sure to learn the preparation and usage instructions from your healthcare professional. Before using, check the product for particles or discoloration. If you notice either of these, do not use the liquid. It's important to store and discard medical supplies safely. While receiving the drug, you may experience infusion reactions, such as flushing or dizziness. If this happens, tell your doctor right away. Make sure to continue using the medication until the full prescribed amount is finished, even if your symptoms improve. Stopping the medication too early may result in the infection returning. If your condition does not improve or gets worse, be sure to inform your doctor. After receiving the injection, you may experience swelling, redness, or irritation at the injection site, as well as nausea, vomiting, diarrhea, headache, or trouble sleeping. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience any serious side effects, such as signs of liver disease, like nausea or vomiting, loss of appetite, dark urine, stomach pain, or yellowing of the eyes or skin, signs of kidney problems, like changes in the amount of urine, unusual tiredness, shortness of breath, signs of infection, like fever or chills, easy bleeding or bruising, mental or mood changes, such as anxiety, or fast or irregular heartbeat. Although it is rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so if you experience any other effects not mentioned here, it's important to reach out to your doctor or pharmacist for guidance. If you are in the US, you can contact your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can reach out to your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before starting Micafungin, make sure to inform your doctor or pharmacist about any allergies you may have to this medication or other similar antifungal drugs. This medication may contain ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have liver or kidney disease. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's recommendations. It's important to be aware of potential drug interactions when taking Micafungin 100 mg intravenous solution. This medication may interact with other drugs and affect how they work, potentially increasing the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medications. If someone has taken too much Micafungin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to have regular lab and medical tests while using Micafungin 100 mg intravenous solution antifungals, Glucan synthesis inhibitors. These tests may include checking your liver and kidney function, as well as your complete blood count. Make sure to keep all your medical and lab appointments, and consult your doctor for more details on the schedule for these tests. Make sure to take Micafungin 100 mg intravenous solution antifungals, Glucan synthesis inhibitors, Echinocandins, exactly as prescribed by your doctor. If you happen to miss a dose, consult with your doctor or pharmacist to establish a new dosing schedule. Do not take a double dose to make up for the missed one. It is important to stay consistent with your dosing schedule to ensure the medication works effectively. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. Do not dispose of this product by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.